I think it's pretty safe to say that most Americans are just not happy about their health care. They're not happy about the quality of care that they're receiving, and they're also not happy about the options that they have to pay for that health care. So in today's video, I'm going to talk to you about a couple of solutions, some alternatives to health insurance that are available to you right here and right now that's going to give you a much better healthcare experience here in America. So if you want to get about 90% of your healthcare needs taken care of, I highly recommend looking up a direct primary care or a DPC doctor near you. Just do an internet search, do DPC doctor near me or direct primary care doctor near me, and you will find a local doctor to you that offers a subscription model to their services. This is usually a flat rate, very affordable. Think of it like a more affordable version of a concierge doctor. No, they're not concierge doctors, but they're a much more affordable version of them. DPC doctors usually will offer same day or next day appointments. This is where you can get your annual wellness visits. They usually offer really big discounts on like labs and imaging if you get it through them. Some doctors will give you like their phone number that you can text or call them at any time. They will, and some will even come to your house. Even though they're not a concierge doctor, some will even come to your house if needed. Of course, I'm hoping I never need that, but it's kind of nice to know that I can. That's available to us, right? Like I said, this is a much more affordable option to be able to have a lot of access to a doctor. This is great for people that are healthy, people that have kids that get sick or have accidents, and you just want to have them get seen, have them have follow-ups, things like that. It's really helpful. But also if you're dealing with like something more chronic or more severe, this is the doctor that's going to be working with you to help you get the help that you need to get as healthy as you possibly can. So yeah, look up a DPC doctor near you. Also, something that I want to add is that these DPC doctors, if you have a doctor through an insurance, like an insurance model, they usually on average will spend anywhere from 7 to 15 minutes with you. There's only so much that you can do in that appointment time. However, with the DPC doctor, because it's not through insurance, these are doctors that will spend anywhere from like 30 minutes to an hour or longer with you to make sure that you get the health care and help that you need. Also, these are doctors that are gonna recommend things or help you with things that you actually need. And it's not gonna be like, oh, I can't offer you this because your insurance doesn't pay for it. There's none of that. There's none of those like middleman saying what you can and can't have. This is a doctor that's gonna, again, work with you directly on what's best for you to get you healthy and staying healthy. So I highly recommend looking up a DPC doctor. Now, obviously, depending on where you live may depend on how available they will be to you. But I am seeing more and more DPCs popping up in America, and I'm super excited about this. This is a trend that I believe is going to just grow, especially over the next 5 to 10 years. So I live in the suburbs, and I have about 3 or 4 DPCs within about 15 miles of my house. Now my sister lives in a much smaller community. She doesn't have anybody near her. The closest DPC doctor is about 50 miles away, but it's in the next city. She travels there to get to the Costco in that city anyways, but she would have to travel about 50 miles, but in that city, there are 4 DPCs in that city. So again, it kind of depends on where you live as far as how available this is going to be to you. But if you have a DPC doctor near you, I highly recommend checking them out, because probably about 90% of your healthcare needs can be taken care of through a DPC doctor. So what about the big stuff? What about, hospital stays, surgeries, cancer, maternity benefits, things like that? That is where a nonprofit health share comes in. These are, like I said, nonprofit organizations, but they are an alternative to health insurance. Now, this is not for everybody. This is for somebody who is under 65 years old and someone who's already healthy, someone that's healthy before they join the health share. So the reason I say that is they will accept you if you're not healthy, but they will not pay for any pre-existing conditions. At least not in the first year of membership. Into the second year of membership, they will pay for pre-existing conditions up to a certain amount, like maybe $25,000 or $50,000, depending on which health share you decide to join. But and then the third year of membership, they'll pay more for that pre-existing condition. Again, this is only limited sharing related to those pre-existing conditions. But that is an important thing to know before you join a health share. So how a health share works is pretty simple. You basically pay a small monthly amount to the health share, and if something major were to happen, let's say you needed a surgery and the surgery is an unexpected event. Let's say you have an accident, you were out mountain biking and you break something, you need surgery, you need a hospital stay, and let's say everything is a total of $50,000. Now, this is not related to a pre-existing condition, so we don't need to worry about that. But if you were to have an accident and have the hospital stay and surgery and all that stuff, and it's up to $50,000, you as the member would pay your member responsibility amount, also known as like an initial unshareable amount or IUA. But basically, it's saying, okay, you said your member responsibility amount is $1,000, so you pay $1,000 towards your medical bill, and then the health share will pay for the rest of that. So if it was $50,000, I'd pay $1,000, and then the health share would pay the remaining $49,000. That is simply put how a health share works. What's cool about the health share is it is nonprofit. So I would say most of that money that you're putting into the health share every month is actually going towards other people and their medical expenses. So, this month it's someone else, next month it might be you or your family member. So it's a great way to be able to pay for large and unexpected medical expenses. So my family, we have both a health share for the large and unexpected medical events that might occur. And then we also have a direct primary care doctor for kind of most of our healthcare needs. Together, combined with both of these memberships, we are still paying less than half of what health insurance costs. So it's definitely something that I highly recommend looking into, not only to have more affordable healthcare, but also to have a better healthcare experience. If you guys would like to learn more, be sure to check out my free guide. I have a guide that tells you a lot more detail about how health shares work, what they are, how they got started, and talk a little bit more about what to look for in a health share to find the right one for you. Until next time, I'll see you in the next video. Bye guys.